Hello, good morning. My name is Juliet Peripheral. I'm one of your education coordinators here in the education department. Thank you for submitting the answers to the pre-test and viewing the assigned videos about IV starts in care and maintenance that I sent to you via email, because this class is only, or this lesson is only for 15 minutes and we don't have enough time. Okay, so the plan for today is I'm gonna do some PowerPoint presentation, and I provided you with the printed slides and some notes, and you can follow along with me, and at the end we're gonna do a practice session. Okay, and then I will be going around and supervise you. Alright, so let's start this lesson. Peripheral intravenous catheter management. Our objectives are to utilize current evidence-based guidelines for the management of patients with peripheral intravenous catheters. All clinical personnel will practice the safe and appropriate care of patients with peripheral intravenous catheters. Procedure. Placement responsibility are done by trained personnel. What that means is only trained RNs, patient care techs, LIPs, licensed independent practitioners like the medical doctors, PAs, and or nurse practitioners that are allowed to start IVs. Site changes for the peripheral IV catheters are not to exceed 96 hours or 4 days. And if it's needed that the patient is a hard stick and we have to keep it, then we need an order from the licensed independent practitioner. When we need to convert the IV to saline lock, we also need an order from the licensed independent practitioner. So if needed, that if the patient is really a hard stick, that we have to use the lower extremities, that will be the last measure, and also we need to have an order from the LIPs or licensed independent practitioner, and that we need to closely monitor that patient for phlebitis. Alright, for catheter selection is based on the patient's age, condition of the veins, prescribed therapy, vein size, type of medication to be infused, and the length of treatment. Make sure that we use the smallest gauge suitable for the type of medications, purpose, and location. Peripheral catheter placement and dressing changes. When possible, we start the IV in the patient's non-dominant upper extremity to ascertain that the patient is right-handed versus left-handed. Begin with the distal part of the upper extremity. Vein size and catheter gauge should be large enough to accommodate catheter gauge and the length required to deliver the prescribed therapy. Suitable veins to utilize are your metacarpal vein at the back of the hand, basilic or cephalic vein, and median cephalic inner aspect of the elbow and antecubital fossa. Peripheral catheter placement and dressing changes. If a patient is a difficult stick, we can use a vein locator for venipuncture. Sites to avoid. Do not place catheter where the circulation is impaired and or there is a restricted extremity, like there is a shunt or pending shunt placement, or for in cases of status post mastectomy. Location of tourniquet placement. Apply tourniquet 2 to 6 inches above the desired site and ascertain satisfactory distension. Distal pulses should remain palpable while tourniquet is in place. Prepare skin for IV insertion by cleaning the site. If this is the site, prepare the skin with chlorhexidine gluconate solution or 70% alcohol. Then remove the tourniquet when catheter is inserted. Stabilize IV catheter if it's in here with a catheter securement device. Alright, how about when the patient is a hard stick and you are attempting to do it? What is our policy on that one? So after you are allowed 2 unsuccessful attempts and you need to seek assistance with other trained personnel who are also allowed 2 more attempts, and after that you're gonna need to seek help from the licensed independent practitioner, and all unsuccessful attempts need to be documented in the medical record. Catheter patency, flushing and locking. Catheters are to be accessed using a needleless system only. Minimize contamination risk by scrubbing the access port with appropriate antiseptic solution. We use chlorhexidine gluconate, 70% alcohol, or povidone iodine, and accessing the port only with sterile devices. Also, we utilize the passive disinfection process called Curos. So if you have other ports that are not being used, you can use Curos cups. They are green cup colors, and you put it in there, and it's good barrier for 7 days if it's not removed. So the chemical ingredient is composed of 70% alcohol there. It is a physical barrier that will help prevent infection. If there is resistance involved in an IV site, then we can remove it. And if you find leakage in the tubing, you also have to remove that and replace it. Catheter patency, flushing and locking again. We use normal saline for flushing, okay? And we do that before and right after you give medication. Blood draws are not allowed on the PIV site except for the initial insertion. We need to monitor the site every 8 hours and document it. And if the patient complains of pain on the site or you observe swelling, then you have to stop the infusion, remove it, and restart it on the other side. When you notice any complication, phlebitis, swelling, or infiltration or extravasation, you're gonna have to document it and trigger the wound consult, so they will come and look at it and assess it. Peripheral catheters are good again for 96 hours maximum. For IV tubing, it's either primary or secondary tubing. It's good for 96 hours unless it's been disconnected from the primary site, then you have to change it right away. For the secondary tubing, we change it daily unless it's disconnected from the primary tubing. Those flush lines, we need to change it 24 hours, and the IV fluids are changed every 24 hours also. Dressing changes. Transparent dressing is used when you are inserting a new IV. Non-transparent dressing, we need to change it every 48 hours or PRN when it's soiled or oozing with something. Documentation. What do we do with documentation? On the catheter, after you insert the IV, you put the insertion date, initials of the one who did it on the catheter dressing, okay? And you put the date, the time when the IV fluids are hung, and you put a label on it, and when when it will need to be changed. Medical record documentation, insertion of the catheter, date and time, insertion site, type, catheter gauge, number of attempts, the condition of the site to include drainage if it's there, and you also document for infiltration or if you notice phlebitis. So document also the dressing used if it's patent and the equipment we use, and document after discontinuation, and after that educate the patient before even you're doing or you're starting an IV on an ongoing basis, and also educate the representative, especially the patient family if they're there. So I have my references on your slides that you have with you, and any questions? Okay, so that's good. So the next segment of our lesson is practice session. So I have provided mannequins here and different types of needles, and we can I'm gonna go there and supervise everyone and those who wants to practice IV start on a mannequin or on a block, and I will be going around and supervising each one of you. All right, thank you very much, and I'll be there. Bye.